Hypoglycemia is defined as a drop in blood glucose levels to less than 0.5 in non-diabetics and less than 0.7 in diabetics patients. There is no obvious link between clinical manifestations and hypoglycemia severity. A positive diagnosis of hypoglycemia requires taking into account the clinical symptoms, which may be split into three categories. The neurovegetative syndrome includes symptoms such as sweating, paleness, palpitations, tremors, painful hunger, and fatigue. Neuroglycopenic syndrome represents cerebral distress and is characterized by symptoms such as blurred visions, mood disturbance, agitation, and deficit signs like hemiplegia, diplopia, and aphasia. It can progress to seizures and coma. In the hypoglycemic coma stage, initial signs include increases osteotendinous reflex, cold sweats, and hypothermia. As the coma progresses, it becomes calm and areflex.
So keep that in mind.
To confirm the diagnosis of hypoglycemia, a venous blood glucose levels of less than 0.5 in non-diabetic patients is considered indicative of hypoglycemia, as we mentioned before. It is critical to identify the underlying cause of hypoglycemia to appropriately manage the symptoms, but it should be done outside of emergency situations. In diabetic patients, hypoglycemia caused by insulin can be triggered by dietary mistakes, excessive drinking, unexpected exercise, or insulin overdose. In some cases, a kidney failure or gastroparesis. Lipodystrophy from insulin injections in the same area of the body can also be a cause, as well as some associated conditions that lower insulin needs. Hypoglycemia related to use to some medications can be caused by non-compliance with contradictions, absolute overdose, more commonly in elderly patients, or some drug interactions with other medications, including diuretics, etc. Organic hypoglycemia is less common but more severe in diabetic patients. It can have a variety of reasons, including endocrine conditions such as severe hypothyroidism, anterior pituitary or adrenal failure. Hypoglycemia can also be caused by severe hepatic or renal failure. Chronic malnutrition caused by malabsorption or dietary deficiency, shock, or acute septic illness. In some cases, no evident cause is found, but possibilities include insulinoma, a usually benign tumor that can be located in the pancreas, can also be a cause, or some extrapancreatic tumors, particularly mesenchymal tumors in the thoracic or abdominal areas. Functional hypoglycemia occurs in specific contexts, such as postprandial periods following digestive surgery or in individuals with obesity or pre-diabetes.
That's a lot of stuff.
Therapeutic management of hypoglycemia involves addressing the immediate symptoms. In conscious patients, oral administration of 15 to 20 grams of rapidly absorbed sugars can be done by eating sugar cubes or drinking a cup of orange juice or soda. Jam or honey can also be useful. In unconscious patients, intravenous administration of 30% of a glucose solution in a bolus of 14 to 18 may be necessary, followed by a possible infusion of 10% glucose solution. All interventions should be performed under a medical supervision, and the treatment focused on addressing the underlying cause. Thanks for watching.